Welcome to the Principles of Anatomy and Physiology course. In this lecture, we will go through definitions of anatomy, physiology, how they are connected, levels of organization when it comes to cellular components, different organ systems that we will study during this course, and also some terminology when it comes to anatomical positions. So, what is anatomy and what is physiology? Anatomy deals with structures. It talks about the morphology, it talks about parts of the body and how they are organized. So, anatomy is everything to do with structure, everything to do with how things are organized in our body. When it comes to physiology, it is the study of functions of how these parts work together. So, physiology is the functional aspect of the structures that are defined by the anatomy. Anatomy and physiology are two disciplines that are closely interrelated because function is determined by the structure. So, structure determines function of organs. And when it comes to anatomists and physiologists, anatomists rely on observations and dissections to observe what the structures are and how it relates to the other structure. When it comes to physiologists, they employ experimentations. They will need to set up experiments to see how things function. So, as I discuss, function is determined by structure. If you have a structure that is like a solid rock, it will have a certain function. If you have something like a mouth or an oral cavity, that will determine what function it will perform. When it comes to our body, when it comes to the different organ system, this is just a reminder, this is just an overview of how these parts are formed, how it's broken up. The smallest particle in our body is going to be the atom. Atoms come together to form molecules. Molecules form much larger macromolecules, and macromolecules are used to form parts of a cell called organelles. Organelles come together to form the cell. Cells come together to form a tissue. Tissues form organs, and organs put together form organ systems that form a certain common function, and organ systems together forms the organism, in this case human. So the body consists of several organ systems. Organ systems, they usually form a specific function, but when they are put together, they help accomplish the function of a certain organism. And this contributes to a concept known as homeostasis. Homeostasis is the concept of internal balance. In our body, we like things to be at a certain controlled condition. Homeostasis will help maintain that particular balance. And we'll talk about this more a little bit in this lecture and even throughout this course. One example I'll give here is going to be body temperature. Our body is controlled at a very specific temperature, and if the body temperature increases or decreases, the body has certain functions that will bring it back to the ideal temperature for our physiological function. And also, different organ systems will form different functions. The organ system that has like a body covering is going to be called the integumentary system, and this includes skin, hair, nails, anything that forms the outermost covering, outermost layer of our body. So we will see a lot of these types of diagrams. What we see here is going to be the certain organ system or certain structure that we would like to highlight will be highlighted in blue. compared to the regular body. So what we see here is the integumentary system is going to cover our entire body. So that in itself is an organ with the function to protect the internal organs of our body from everything in the external environment. And then we have the skeleton system. Skeleton system, as you can see, composes of all the bones, all of them connected. They will form a specific function. In this case, they help maintaining the body's structure and they help with movement. And the next system is going to be muscular system. This is going to contain all the muscles included in our body, muscles working together with the skeletal system will help with movement in our body. And then we have the nervous system. Nervous system will have the central nervous system and also the peripheral nervous system. Taken together will be the messenger system that will help control different functions, both voluntary, meaning the things that we can control, and even involuntarily. And then we also have the endocrine system. This is another messenger system which will produce certain certain messages for certain organs, and then put it into the blood so that that would be taken to the appropriate organ to perform that specific function. And then we have the cardiovascular system. As we can see, cardio is the heart, vascular are the blood vessels. So the heart taken together with all the blood vessels form the cardiovascular system. And this is where all the nutrients, nutrition and oxygen that would be transported between organs all throughout the body. So it's also called the circulatory system. And we also have a lymphatic system. This is a drainage system that will bring fluids back towards the heart, but also have an immune component that will help fight against certain bacteria, certain pathogens that can be in our body. And we also have the digestive system that will help digest the food that we eat and absorb nutrients into the body. And respiratory systems, again, breathe in and help with oxygen exchange, oxygen and carbon dioxide exchange, obtain oxygen to the body and put out carbon dioxide from the body. And the urinary system is the filtration system that will filter all the blood that's been circulated in the body to get rid of any unwanted materials, any toxic materials, any byproducts that were produced in the body will be excreted from the urinary system. And we also have the reproductive system that will be involved in reproduction. So we just went through different organ systems that are present in our body. When we looked at the levels of organization, we discussed how different organs come together to form organ systems, and organ systems put together form the organism, or in this case, human. So in this particular course, what we will do is after we go through some of the more structural components, some of the more key elements, we will then get to the different organ systems and see how different structures, how the anatomy of those systems together help to form the function that they are supposed to do. When organ system all comes together, they interact to create a homeostasis. So that's going to be just to control the internal balance of the body to maintain our body at the optimum conditions for survival. So the last portion of this lecture, we will look at some anatomical terminology. These are certain terms that we will regularly use to describe certain positions of certain organs, certain movements, to orient the reader or orient the individual to what we are describing. And when we describe anatomical terminology, we also want to consider the anatomical position, which we'll show in just a little bit. This is a position where an individual will be standing facing forward. Both upper limbs will be at their sides, having the palms facing forward. So when an individual is standing upright, facing forward, and hands with their palms facing forward, meaning the thumbs are going to be pointing towards the outside, that is going to be the anatomical position. So most of the terminology will be associated with the anatomical position. So as you can see here, this is going to be the anatomical position. An individual facing forward with the hands or the upper limbs on the side, with the thumbs facing towards the sides, also called lateral. So anything in a particular system, in anatomy, if you hear the term superior, superior means something above. So in this case, we can say the forearm is superior to the fingers, or the nose is superior to the mouth. So anything that's above is superior. Likewise, inferior is anything that is below a certain point of reference. So we can say the ankle is inferior to the elbow. So inferior is below a reference point, superior is above. And anterior and posterior. Anterior is going to be in front of a reference point. Posterior is behind a reference point. So we can talk about how the abdominal muscles are anterior to the muscles of the back. Posterior the same way, something that's behind. Then medial and lateral. If you draw a hypothetical line across a human, anything that's closer to the midpoint, to this medial line, is called medial. Anything that's away is lateral. So we can see that the pectoralis muscles or the chest muscles are going to be medial compared to the deltoid muscle, the muscle that's going to be in the hand. Even if you look at these fingers, we will see that the smallest finger is going to be medial compared to the thumb. Lateral is more on the outside. So from a point of reference, anything out is lateral, anything closer to the midpoint is medial. Then proximal and distal. When we consider these limbs are going to be the extremities, your arms, hands, and your feet. Anything that's towards the body is going to be proximal. Anything that's away from the midpoint of the body is going to be distal. So proximal, for example, we would say the muscles on the arm is proximal compared to the muscles or compared to the muscles on your hand. Distal is more away. And next it's deep and superficial. If you consider the body, even a cross section, anything that's within the body will be considered deep. Anything that's more towards the skin is superficial. So when we consider internal organs, the fats that's within the body, that will be considered deep. When we considered anything that's along the skin or the upper layers, that will be more superficial. And then we also have the axial and appendicular portions. Axial is going to be all this mid-component, the head, the main core part of the body. Appendicular are going to be your hands and your feet. So upper and lower limits will be parts of your appendicular skeleton or appendicular portion. Axial is going to be the head and the core part of the body. And as we can see here, axial portion will have the head and the core part. All right, so this is just again putting everything together, the relative position in anatomy. you will have a midline as a reference, you will have proximal, the distal, medial, lateral, and once you get more familiar with this thing, you will be able to describe positions of certain parts of the body much more easily. All right, so the last part of this portion is also going to be the quadrants of the abdomen. When we are describing the abdomen, we can divide it into 4 components. This can also be divided into 9 components, but for the purpose of this class, this course, we will consider it has 4 components called the left upper quadrant, left lower quadrant, right lower quadrant, and right upper quadrant. These are important as when we are looking at our abdomen, there are certain organs that are arranged in these positions, and this will help us name or even associate certain organs that live in a certain quadrant. So this is also important when it comes to physicians. When you go to the physician and you say you have a right lower quadrant pain, the physician will know what type of organs live there and what to look for, as opposed to the left or as opposed to the upper quadrants. And this is again shown here, the 4 quadrants in terms of describing the organs present in the abdomen. Same things presented here. So that's all I have for this particular lecture. If you have any questions, please feel free to email me or post them on the discussion board on Canvas. And I hope you will be able to go to the reading portion for this lecture and maybe even go through some key concepts.